First of all, thank you and welcome for being here. I hope you are healthy and well. As we know, all leaders right now are trying to find their footing. You're probably shoring up your business plan and situating your team and juggling your own remote working arrangements, possibly alongside your spouse or children. And on top of that, you may face a test that you probably wouldn't even imagined a few weeks ago, and that's when one of your employees tells you they've tested positive for COVID-19. And if you haven't dealt with that already, you almost certainly will. So it's a particularly complex challenge because not only does the moment call for sensitivity and humanity, but it also requires you to act quickly as a manager. So today we're going to talk about how to reduce the risk in the workplace, some guidance for you and steps to take when an employee tests positive, and how to address the fears that might exist within your organization of other folks. So I'm going to do my best to answer questions. This is a brand new kind of fluid and ever-changing COVID world, so hopefully you'll leave this webinar with a little bit more information than you came in with. So businesses operating on site during COVID-19 have to take extra precautions to ensure you're not subjecting your employees to an outbreak that could be avoided using reasonable protections. So you have to ensure your employees are either maintaining the most current guidelines on social distancing or provide tools that reasonably intend to protect those workers that are unable to do so. So OSHA has actually released guidance on preparing workplaces for COVID-19. There aren't any new standards generally, but it does say that you do have a requirement as an employer to furnish a place of employment which is free from recognized hazards. So I also want you to be aware that OSHA regulations state that employees can actually refuse to come to work if they believe that they are in imminent danger. So what does imminent danger mean, right? So we're going to talk about the different levels of OSHA real quick and what your requirements are with those types of folks. But if you're doing social distancing, remote work, sanitizing and cleaning, people are wearing masks and all of those things, then you're providing a safe environment for someone. If you weren't doing any of those things, then they may have an argument to say, I'm scared to come into work because there's an imminent danger. So that's what they mean by that. But if you're following the protocols and the precautions, then you're creating a workplace that people shouldn't be afraid to report to. So there's different exposure risks for workers. So OSHA classifies them in 4 different levels. You've got your very high risk, which of course are your doctors, paramedics, COVID-19 that they're exposed to on a regular basis. The high is like a medical transport worker. Medium would be a retail worker, someone in the grocery store, and then lower would be someone who doesn't have frequent close contact with the general public. So if you just have a few employees, or just even speaking to Diana there in the office, there's just a few of you and it's in the office and generally separated from each other, et cetera, that would be considered low risk. I think I've got someone. Okay, awesome. Yes. So basically, you definitely would fall in that lower one. So what does that mean? So what OSHA says is that based on the worker's level of risk, OSHA recommends certain protection measures. And I'll just talk briefly about each one of them. There's engineering controls, administrative controls, personal protective equipment, PPE. We've all been hearing about that. And in most cases, a combination of these is going to be effective in protecting against exposure to COVID-19. So the engineering controls are very effective. These are things that you can control, like physical barriers, sneeze guards, increasing your ventilation, installing more high efficiency air filters, increasing the percentage of outdoor air that comes in. Those are all ways that you could kind of control your environment and are considered engineering controls. Then you've got your administrative, and these are changes in work policy and procedures to reduce or minimize the exposure to hazards. So encouraging your employees, if you're sick, don't come in, or modifying work shifts so that not everybody's together at the same time, or increasing that physical space between employees or between employees and customers. Those are administrative controls or safe work practices. We know about wiping down on a common basis using anything that's commonly touched, like telephones, doorknobs, handrails, light switches. Providing resources to your employees, from hand sanitizer to tissues, alcohol-based wipes, etc. Promoting hand washing on a regular basis, social distancing, and opening those lines of communication. And educating your employees, most importantly, on what are the symptoms and how do they reduce exposure. You can do that through posters, emails, the internet. Like CDC and WHO, World Health Organization, have tons of these really helpful posters and things that you can actually print up and put in your workplace just to keep people educated on what it is that they need to do. And then, of course, we all know about PPE, right? So these are the standard issued by OSHA that says you should have these things available to people. Obviously, it's very difficult to get an N95, but gowns, gloves, face shields, either making sure that your employees are able to get those on their own or providing them to them if they are not. So that's the PPE. And as we know, there's certain practices that we could put into place, and that's providing adequate, usable, and appropriate training and education about business essential job functions, including proper hygiene and practices, implementing daily reporting regarding symptoms. There's many companies that are saying, you know, how do you feel? Do you have a fever? Do you have a cough? Do you have these things? All of those types of things are implementing temperature testing too. A lot of organizations are doing. And although an employer may not run afoul of the Americans with Disability Act, if you are going to do, if you're going to engage in an interactive process, you're going to actually be temperature testing. I don't think most of the companies that I'm talking to on this right now have more than 15 employees, but they just want you to be careful that if you're putting things into place where you're doing temperature testing, that you're temperature testing everyone, documenting and asking those questions to get affirmative answers from your employees, whether or not they feel good to be coming into the workplace. So, and of course, if you haven't already, you should put together what they call like a disaster policy or infectious disease policy, so that people are aware of what the procedures are and what the policies are in your organization. Let me just look at the chat here. Ah, yes. Okay. Yes, Diana. Medical records, yes. Yeah, you want to keep those for a long time, but I don't even think that people are writing anything down from a temperature perspective. I haven't seen anybody do it. I mean, I would think the only reason you would want to write it down is if someone did have a temperature, then of course, maybe you just should be sending them home. But from a policy and procedure standpoint, they just talk about making sure that you're minimizing contact among workers, clients, and customers. Like if you can do something that's not face-to-face, you know, put something else, telework, these types of meetings into place as opposed to exposing people to one another. Establishing alternative days and shifts that reduce the total number of employees that are ever in your company at the same time. So my husband works at Bosch & Lomb, and that's what they've done there is they've really limited, if they do have to have people run machines, these essential workers, they're doing it in such a way where they're staggering shifts and staggering the number of people. Of course, discontinuing non-essential travel. If you don't have to travel, we'd rather you didn't. And developing your emergency communication plans. So those are all part of your work policies and procedures. And if you need an infectious disease policy, I do have one that I could provide that you could tailor to your organization. And then, of course, we want to talk about flexibility, right? So obviously, we know that the Families First Coronavirus Response Act gives paid sick leave to folks who are either quarantined or have a stay-at-home order or in an area that has outbreaks. But the thing that they do ask is that you do not require a healthcare provider's note for an employee who's sick to validate their return to work. And the reason they say that is that we're already overwhelmed with people going into the doctor, people being in the hospital. And what's happening is if you're requiring people, if they have a stuffy nose or they're not showing any signs of coronavirus, but they're sick in some other way, and then you're making them go and get a doctor's note in order to come back. They're just saying that, you know, it's extremely busy and it's not really something that you should be practicing. However, if someone did test positive for COVID-19, either have them do the full quarantine after their symptoms are gone, or have them bring in either a negative testing or a doctor's note. So, but they just say it's just a routine person calling in sick and they're not exhibiting symptoms. Don't, you know, force that doctor's note because it could overwhelm healthcare and medical facilities. Okay, so what you're all here for, let's talk about what happens if an employee tests positive. Somebody calls you up and says, hey, Diana, I went through the drive-through and I got tested and 2 days ago and I got my results and I'm positive. So the very first thing that has to happen is the infected employee needs to be sent home unless released by their medical provider. So they've got to be sent home if they're not already there. You should send home all employees who worked closely with that employee to ensure that the infection does not spread. Before the employee goes home, You need to ask them to identify all individuals that they worked closely with within 6 feet for a prolonged period of time, 10 minutes or more, 30 minutes or more, within a 48-hour period before their symptoms started. When sending employees home, do not identify the name of the infected employee. However, if you've got a small company, it's likely they're going to realize who it is anyway, especially when they don't come into work the next day. But try not to identify the name because you don't want to risk any violation of confidentiality laws. If you work in a shared office or building or area, you need to inform building management so that they can take precautions where they deem necessary. Maybe they want to come in and clean the facility or do something with the air filters or air handlers or something along those lines. So let them know so they can take precautions. The CDC also provides that employees who've worked closely with the infected worker should be instructed to stay home. Now, they're old. This is actually, I just found out today, it was 14 days. CDC has changed their guidelines to 10. So it's 10 days after last exposure, maintaining distance from others, and self-monitoring for symptoms. So they have lowered that to 10 days. So a little bit different changes. If you want to see what their changes are, you can look up on the CDC's website and they'll give you some different guidelines. But it's changed from 14 to 10. So once you've taken those steps, the next thing we need to do is we have to have your employees self-monitor for signs or symptoms of COVID-19 if they suspect that they've possibly been exposed to someone. Employers should develop policies and procedures for employees to report when they are sick or have signs or symptoms of COVID-19. Hi, Becky.
Hi.
Welcome.
Sorry, it took us a while.
That's okay. We're just getting into the, I think we're in our second slide here of talking about what to do if somebody says you're positive. So I will, I'll just mute you and I'll keep going.
Thank you.
Okay, awesome. Okay, so yes, you need to instruct and encourage your employees to let you know, to self-monitor and let you know when they aren't feeling well or they feel they might have symptoms or they possibly have been exposed. Develop policies and procedures for your employees to report when they're sick or when they're experiencing symptoms. So who do they call? Who do they let know when that's going on? I think the worst thing that companies can do is make someone feel guilty or feel scared to let them know that this is going on. So you need to make sure that your policies and procedures are open so that people feel comfortable. Let them know you have to immediately isolate people who may have had signs or symptoms and move infectious people away from other customers, workers, and coworkers. And of course, restrict the number of people. So usually when someone finds out they've gone and gotten tested and they've already been at work for a couple days and 3 days later the test result comes in. So now you've got to take those steps to determine where they were, who they were around, and instruct your employees accordingly. So after that's happened and we've identified them, we've told them to stay home, we've isolated other people, we have them do their self-monitoring, we strict number of the people that are coming in. Obviously our next step now is clean it up, right? Where have they been? Close off the areas that that person has been in. Wait as long as you can, practically wait at least 24 hours as a suggestion before you head in there to clean and disinfect. Open outside doors and windows if you get increased circulation in the area. Clean and disinfect frequently touched objects and surfaces like keyboards, telephone, handrails, workstations, and of course soap and water and using alcohol solutions. Now, what I've shared with you right now doesn't talk at all about leave or pay. That could be a whole nother webinar in itself. I just wanted to cover with you the basic steps to take if your employee calls you up and says, I've tested positive, the steps that you need to take to ensure the safety of the rest of the people within your organization, as well as the practical steps to take as far as cleaning up and readying the workplace for people to come back into it. So what I'll do now is just kind of briefly touch on some of the most common questions that I get. So the first one is, what if my employees have a suspected but unconfirmed case of COVID-19? So you're going to want to take the same precautions as if they had tested positive for it. Treat the situation as if the suspected case is confirmed for the purposes of sending home potentially infected, communicating with your affected workers to let them know that an employee is not tested positive, but is exhibiting signs that lead you to believe a positive diagnosis is possible. This just happened with my daughter. She works for Wyndham, and she didn't think she had that. She just had congestion and she was coughing and she didn't feel good. So they immediately let those people that she worked with say, hey, she's going to get tested. She doesn't have a positive test yet. However, it could be a positive diagnosis, and making sure that your employees are aware. What if your employee comes into contact with someone who has tested positive? Again, same steps, except you need to communicate to your employees that the employee is not showing signs of the virus and that you're just acting out of an abundance of caution. What can I do if a new hire has symptoms? Well, you don't have to have them start. You can push back his or her start date. For similar reasons, if the new hire cannot safely enter the workplace, you can even withdraw the job offer. So if you newly hire someone and this happens, those are the steps that you can take. So let's say your employee calls in. What if your employee calls in and says, hey, I think, I'm experiencing symptoms of COVID-19. They call in, but they don't say it, but they're just like, oh, I can't breathe really good and I'm coughing. And you can ask them, are you experiencing the symptoms? Just remember that you need to maintain all information that you collect from them and make sure that you're keeping it confidential and be compliant, right? Especially with the ADA if you fall under the Americans with Disability Act. So just ensuring that you ask those questions. And there are a list of them that you can pull down from the CDC, asking them if they're experiencing a fever, shortness of breath, cough. There's certain things that you can ask them. And if they aren't experiencing any of those things, it may not be COVID and they just simply need to stay home and they're sick. So can you take an employee's temperature to determine whether they might be infected? Yes. I think everybody knows this. I think a lot of places we even frequent now are doing, I went to get glasses the other day and they did the temperature check and asked me the question. So the EEOC has confirmed that measuring an employee's body temperature is permissible given the circumstances. However, you need to remember that an employee could be infected with COVID-19 and not exhibit any symptoms. No fever, no cough, they may not have any of those things. So while taking a temperature is a good protective measure for you, it may not always be the most reliable in terms of whether or not someone is actually infected. So it's a give or take. I think what most people consider when it comes to their organizations is just making sure that you're doing all of the things you need to provide the highest level of protection for your employees, and just making sure that you're communicating often and regularly regarding those things. So fear, this is something that I think is really important. So we need to talk about COVID-19. You do need to talk about it. You don't need to attach locations or ethnicity to disease. And we've heard nicknames for this. The official name was actually chosen to avoid stigmas. The CO stands for corona, the VI is for virus, the D is for disease, and the 19 is because it came out in 2019. Do talk to people who have COVID-19. Don't refer to people with the disease as cases or victims, right? Talk to people about acquiring or contracting. Do you use it in that fashion? And don't talk to people about transmitting or infecting others or spreading the virus, because it implies that people are intentionally doing this and it assigns blame. And again, you don't want your employees to feel like they can't come to you or let you know when they're not feeling well. So if you're using criminalizing or dehumanizing terminology, it creates the impression that they somehow did something wrong and they're less human than the rest of us. And it feeds the stigma, it undermines empathy, and it potentially refuels like a wider reluctance for them to seek treatment or to go to a screening, to test, to quarantine. They won't want to tell you, so they may report to work not feeling well or possibly with coronavirus because of that stigma. So talk positively about it. Emphasize the effectiveness of prevention and treatment measures. And for most people, this disease can be overcome. So there's simple steps that we can all take to keep ourselves and our loved ones and the most vulnerable safe. Don't emphasize or dwell on the negative or messages of threat, right? And emphasize the effectiveness of adopting protective measures to prevent acquiring the coronavirus with screening, testing, and treatment. So Communicate frequently. Give your employees periodic updates. Let them know that you're staying on top of things and that you know what the developments are. And I think, Betsy, right before you had joined, I let the folks know that the CDC now has new guidelines. It's no longer 14 days. Now it's 10 days from the onset of symptoms. So there are constantly changes. And if you're constantly communicating and staying on top of it and communicating with your employees, that's going to help alleviate fear and uncertainty because they know that you're, staying informed. You can address the general fear of COVID-19 by educating the employees. Make sure they know what the signs and symptoms are and what they need to look for. Post updates from CDC in common areas. Let them know you're monitoring and that you've got the guidance coming from the federal and state agencies. And of course, empathize and listen. Nobody is going to feel better by being told that they're irrational or having their concerns ignored. Let employees know that their concerns are normal and the employer wants to hear them. So give them several channels, whether it's their manager, is it HR, have you implemented a safety committee or some other appropriate channel so that they're comfortable speaking up and talking to someone. And by all means, handle employee concerns seriously. If someone reports a concern related to COVID-19 or they've come back from a recent outbreak area, you need to list and document the concerns as if the employee has come to you to complain about a safety hazard. It's the same thing. And let them know that you're going to evaluate the information and you'll take appropriate steps if it's necessary. And my biggest one is, the being generous, the being creative, those are good too, but you have to make it easy for sick people to stay home, right? Many employees may not have enough paid leave accrued to make it through an illness or a quarantine period. And maybe telecommuting is not an option, which might make them afraid to report their symptoms to you. And some of the absenteeism policies sometimes are really strict, and it can discourage them from staying home. And the economic impact for many employees is really real, guys. And the loss of pay or potentially losing their job, and bills don't get paid, homes can be lost, groceries can be scarce. So if you're able to adjust your policies where possible and be flexible, let them stay home, let employees donate PTO to each other. There's a lot of different ways that you can be flexible, and whatever you can do to reduce the economic impact for them will ease their mind. It's going to instill company loyalty, and most important, it's going to get them to stay home when they're sick, and that's the most important thing. And this is going to, it boosts your reputation because people will see in the community, social media, wherever they share that you're taking care of your employees. Obviously harsh policies with no flexibility work against an employer's reputation. Be generous when you can and try to get creative, whether it's flexible scheduling, alternate work weeks, staggered shifts, rotating telecommuting. There are a lot of different ways that, get lower risk of exposure. Okay. See here. So requirements. So if you actually do have someone that says to you, I've tested positive for COVID-19, what are your requirements for recording and reporting those? So basically, OSHA has a record keeping requirement, but here's the thing that's difficult, right? How can someone prove that the exposure to the virus happened in your workplace, right? So that's where it can be really difficult. So you can't really report it as an injury or an illness unless you're actually able to show that it happened there and that it involves the recording criteria. Maybe there was an outbreak where a whole group of people that work for your organization that work together all had COVID together. So it can be really difficult to prove it, but if you can prove that the COVID-19 illness was contracted from your business, you do have to report that. And there is objective evidence that COVID-19 diagnosis may be work-related if there's a cluster of cases, or if the evidence was reasonably available to the employer, like reports that were learned from general operation. But OSHA says that it's aware that there is an exception with healthcare and emergency response and correctional industries. Risk of community transmission is much higher in those higher level risk, which are like EMS, firefighters, doctors, nurses. So, if you're in a high risk work environment, then, you have to make more decisions about whether or not you report those. But everyone I believe that we have on the call now is that lower risk. So that being said, I know I went through it pretty quick. I didn't want to keep you guys too long. But what I can do, I know that Diana is able to chat with me in the chat. Betsy or Mandy, do either of you have any questions or anything that I can answer for you, or resources that you might need? I guess not. Everybody's so quiet. Okay.
Sorry, I'm driving. I had you on mute.
No, that's okay.
No, this is great. Obviously, I'm not looking, so you're going to have these slides available?
Yeah, so what I'm going to do is I'm actually going to put this recording on the YouTube channel. I can make the slides available, and if you'd like, I also have a checklist that's pretty good for, you can use it for when this happens. So somebody comes up to you and says, I've tested positive, or my husband did, or something like that, like what the steps are that you need to take. So I can make sure and email that to you and make that available also on the Greater TR Chamber website as well. Okay. Oh, and Blaine is there with you. Oh, you're okay. Good. I'm glad you're able to make it, Betsy. I wondered where you were. And hello, Blaine. Okay. So what I'll do is I'll get this loaded up onto the YouTube. I'll share the slides with you after we've completed our webinar here, and then I will send you over the checklist as well. And if there's anything that you need, I don't know if I'm the only one. I may be the only HR person or someone with HR company on the in the Chamber of Commerce. So if you need any type of resources at all, please feel free to reach out to me. I'm more than happy to help. And Betsy said, "Do you care if I send to the Downtown Merchant Group?" No, not at all. Absolutely. Yeah, so I will send you everything that you need. And if you ever want to schedule one of these again with another group that you might be a member of, certainly let me know. Obviously, I trimmed this down to 30 minutes, but it's generally an hour presentation. There's a good deal more that I could certainly cover. So if you know of anybody that you think might benefit from this type of presentation or getting the information, certainly let me know, and I'd be happy to do that. Okay, so I'm going to go ahead and conclude. I appreciate you guys being here for our first Wednesday webinar. We've got more scheduled next week. We're going to have someone from, she's the editor actually of Kidding Around Greenville, and she's going to be sharing a lot of information with us regarding back to school resources that are available for parents. A lot of this Kidding Around Greenville is an amazing website. So such a lot of great resources there. So she's going to be on next week's call. And then the following week, we're going to have Eric Vinson and Bob's last name is escaping me, from City of Greenville. And they're actually going to be talking about some of the programs that are available, initiatives, grants for monies from Greenville Cares, the Greenville Pledge, and then there's also the Palmetto Priority for restaurants. So they're going to be on our webinar on the 26th. So if you know of anybody who might have a great topic or be able to present on something topical for us, certainly let me know, as we like to continue doing these until, God willing, the day we're able to all be in the same room together. So thank you very much to all of you, and you have a good rest of your day, and I appreciate you being here.